let's jump, if we can, to healthcare. What did you think of the Medicaid reforms that Governor Northam changed? I mean, the original deal I thought was a good one. It had a lot of conservative reforms in there, but Governor Northam took them out. What do you think of where we are now? What should happen, since you run Senate Finance?
Well, healthcare is the one thing. It's the biggest beast that we're going to be tackling as we move ahead, because Medicaid expansion is going to eat up a tremendous amount of the budget. And the reforms that he changed and the initiatives that were put forward through the ability to be able to fund these high cost procedures and so forth without expanding Medicaid any further is something that we have got to go back to the table, and we got to figure out how that we do this. Because I will tell you, I don't foresee the federal government sticking to what their percentage is. And as that percentages drop in Virginia, if it drops to 80%, that the feds are going to fund for Medicaid expansion and the state's going to pay 20%, billions of dollars is going to be spent in that program.
Mm-hmm.
We can manage this on our own level, on the state level, a lot easier than we can depending on the federal government to pay the way. Are we ever going to be able to go in now that we've expanded Medicaid and take it out? I don't think so, because then you've got all these people that are enrolled and all these people who are dependent upon it. But you can do reforms within how billings, how the billing of healthcare is done, how services are given to individuals, and you can reform that and make it more affordable and make it more palatable to people to be able to have access to healthcare than just throwing all the money into Medicaid expansion and requiring people to have it. I mean, look, there's many stories I heard from business people who maybe only two of them that own the business, and they're paying $1,800 a month, and their deductible is $6,000. Is that affordable? That's not affordable. So why aren't we making it affordable for them, instead of saying you got to be a part of this program, this Medicaid expansion program, and this is what the cost is going to be? I mean, having that healthcare savings plan, I think, was one of the ideas in order for a business to draw from if there's a catastrophic event. I think the year I was there was Glenn Sturtevant's bill. Those are some of the things that we can do as a state and make healthcare more affordable.
Right.
But if we go down the road of depending solely upon Medicaid, the Medicaid expansion program, it's just going to grow and grow till it takes over our budget.
Yeah, I'm a big fan of health savings accounts. We use them at our company. Our employees loved them.
Right.
Their health care got better. Their health outcomes got better because they're managing on resources better.
Look at how it works for the Amish community. I mean, it works well for them. They have the same programs. They are able to use it, and I think that's the way we've got to go.
Let's take a look at, there was an op-ed in the Wall Street Journal by former Secretary of State George Shultz on Singapore and their healthcare program, and they're heavily invested into health savings accounts. I want to take a look at that one as you go knocking on the doors of the Commonwealth to see if they're going to be largely affectionate for the large man from Southwest, the tall man.
We'll see. That's how well you're received across the state is the important part.
That's right.